dealt with infections and injuries. And so our doctors were largely trained to manage infections and injuries. And this was straightforward because they'd use a medical model where you just come with signs and symptoms. Then samples would be taken to the lab and a lab result would get out. So if you had malaria, you do a malaria test and the doctor would simply treat for malaria and manage any other signs and symptoms such as fever or headache. Now, this kind of model does not work very well with chronic diseases. Chronic diseases tend to affect multiple systems in the body. Chronic diseases tend to complicate over time. They don't stay the same. So if you have hypertension now, 10 years, 20 years from now, it may be something else. It may evolve to affect your heart, affect your brain, and so forth. The other thing is that we have root causes of most of these diseases. And if they're not addressed, these root causes may cause many different illnesses. And a good example I can think of is insulin resistance. And this is something that's very common in our environment because we tend to take a lot of sugar and flour. Insulin resistance is associated with diabetes, with hypertension, with infertility in women, and even with benign prostatic disease. So you can imagine if you start off with insulin resistance, that probably gives you hypertension. And this insulin resistance is not handled by change of diet. What is likely to happen is that 5, 10, 20, 30, 40 years later, you may get different complications and different diagnoses. And if you're not careful with the kind of modern medicine practice we have, where we have specialties, one doctor for the kidney, another for the heart, another for the bones, another for the joints, you can easily end up visiting doctors all your life. Because if you have hypertension and diabetes and arthritis and cancer, yet we have different doctors handling that, it becomes quite complicated for you. Yet, if you identify this root cause on time and reverse it with proper advice and guidance, you'd save yourself all that trouble. So, what are our objectives? When we address root causes of illness, usually we anticipate that you'll get better health outcomes rather than complications as the years go by. We expect your pill burden to come down, which means you should use fewer medications rather than increase your medications. We expect the costs of your healthcare also to reduce. We expect fewer complications from the fewer medications you're using, because the more medications you use, the more drug interactions you have, and the more drug complications you're likely to experience. And this is very important because even though studies are done on safety of medications, usually we don't have many studies on drug interactions. And so if you're using drug A and drug B, the doctor may not know what to expect in terms of drug reactions. So you're better off keeping your pill burden as down as possible. So our pillars in our approach are mainly diet and lifestyle, sleep, physical activity, stress, mental health, and substance use addiction care. And so we combine all that information to help you manage your disease at home. We have several of us who will be coming to the channel. We have a nutritionist. We have a mental health specialist. We have a dentist. And then we have a naturopath, somebody who will come to educate us on alternative medicine options. We look forward to adding value to your journey in the prevention and reversal of chronic diseases. We are here to answer your questions if there are any. We are here to educate you on conventional therapies, on complications, on any information that you may want us to